Well, on this episode of MSU Today, we're going to talk about the burgeoning partnership between Henry Ford Health and Michigan State University Health Sciences to provide hope, health, and healing for all. We're going to get a progress report on this cool partnership and what's going on. And that includes a groundbreaking for a pretty cool new research center that will be one of the key places where this exciting research and medical care happens. So we're going to do that with Dr. Adnan Munkara from Henry Ford Health. Norm Hubbard is with Michigan State University Health Sciences, and Terry Grebe is the Chief Administration Officer for the partnership. Great to have you all here, and just sort of remind us sort of the history, why this partnership is together, and it seems to be evolving very well.
So thank you for the question. This started about 4 years ago, in fact, 2019, and it feels like it was just yesterday. We were just sitting and talking about the future. Dr. Norm Beauchamp and I had the chance to meet together over lunch, our first meeting, and we started talking about ideas about transforming healthcare of the future. And one thing led to the other, and then we got the green light from our bosses to say, yeah, you can pursue that discussion. And we started having more and more meetings just as COVID was hitting us. And this was really our silver lining during COVID, to kind of discuss how, by coming together, that this partnership will be able to transform healthcare for Michigan and beyond.
Well, it was cool to see come into focus as we began talking about the partnership is that MSU's historical strengths in education and research were a great complement to Henry Ford's also strengths there, and Henry Ford's great strength clinically was a complement for MSU's clinical capability. So the good partnerships are based on fit, and that became really apparent, not just in terms of the mission pieces, but also culture around a focus on diversity and health equity, around a focus on research and academics. Henry Ford is unique, perhaps nationally, in its focus on research and education as a major health system, which makes them a uniquely well-suited partner for MSU.
I just want to echo what Norm said. It's really about culture and fit, and it really emanates from both organizations. And really, when we put them together, it is a powerhouse unreckoned.
Let's talk a little bit about the mission then. What is the mission of this partnership?
Well, it's you sort of said it, health, hope, and healing. And I think the idea, if you carry that down to the ground, what does that mean? That means we're training the next generation of healthcare providers and informing the ways in which they're educated. So it's not just the training that we provide, it's how we might change training across the state or the country. We're informing research around how people are taken care of and the kinds of things that are available for them to prevent disease and promote health. And it's not just about medicine, it's around how do we help people worry less about infant mortality or cancer incidents. So it's across the spectrum of care and moving, advancing knowledge for research, and then providing great care to people. Again, meeting them where they are, and not just when they're at their sickest, where we want to provide great care, but also helping them be healthy in their home. So it's really that advancing, making it manifest for the citizens of the state across all three mission areas.
Dr. Munkara, let me come back to you, and let's each of you talk a little bit about your role with the partnership.
So I have served as a partner for Norm Beauchamp as we started negotiating that partnership 4 years ago, and currently I'm serving as the chair of the Health Science Center board, in addition to my role at Henry Ford Health. And in my role, I have the privilege to working with a great team, with a great board, with great partners on both sides, and with Norm Hubbard in his role as president and Terry Grebe in her role as chief administrative officer, to really shepherd the goals as well as the strategies that we have to advance our research in cancer as well as in other areas, our clinical care in across the board, our education mission, as well as eliminating health inequities.
And Terry, we talked before we started recording, two big complex organizations coming together with a single focus, but a lot for you to keep track of.
It is a lot, but it's a noble job. I love it. It's two great premier institutions coming together with such a vision, and you just have to be part of it. And the passion that everyone has for their roles and what we're trying to do together really puts an energy into the system. And it's exciting to be part of the transformation that's going on in Detroit, as well as reaching across the state. I got interested in part because I'm a rural farm girl, and the commitment to rural and urban is impressive, and it's going to touch a lot of people, and it's exciting to be part of it.
And what are some of the ways this partnership is different from others? We are focusing on health disparities, things like that, right, Norm?
There are many answers to that question. The one that occurs to me is, as Terry just said, is that combination of the regional urban focus that Henry Ford has, and the as a land-grant university, MSU's historical focus on the state wide. Each of our health colleges, the nursing school, osteopathic medicine, and human medicine, have faculty throughout the state educate a large fraction of the providers in the state on an ongoing basis. So combining those two things, that orientation towards community-based research and education, as well as the urban challenges that are in Flint, where MSU has been present as a first responder, and Henry Ford's 150-year legacy here in the city of Detroit, are extraordinary ways to bring that to bear in a unique combination. And I think that's unique nationally.
I would like to talk a little bit about what Norm was mentioning regarding health disparities. So if you look at our scorecard and ranking as a nation, we do not do very well in improving the health of our communities. And when you look at it, whether in rural areas or in urban areas, we have a lot of gaps. Our rural communities do not get the health care, whether access or the level of care that we want them to get. Our vulnerable population in urban areas do not get that. And to me, if we really want to improve the health of our community, this is a huge gap that we need to kind of overcome in order for us to drive what we want to drive with respect to healthcare. So this is why the point of health disparity, this is why it's really a focus, because we really believe that we need to improve the health of all of our communities. So whether you are looking at primary health, at population health, managing people, diabetes, weight, hypertension, or looking at cancer care, or you are looking at cardiovascular care, we want to make sure that the best care is available to all our communities. And how to reach out to those communities is going to be important. So this is why the partnership where we are situated, where we serve our communities, is going to help us to address and hopefully bridge those gaps, and hopefully serve as role models for the nation.
One thing I'd say is that your health and longevity should not be a function of the zip code you're born in.
This new research center we've broken ground on, what's cool about that we should know?
So one of the things that we wanted to promote in our partnership is make sure that we continue to advance research in health sciences in a way to improve the health of our community. At Henry Ford Health, we have always been focused on research that makes a difference, that kind of changes our practice, that we are able to kind of make a difference for the patients that we treat, and not something that takes 10 or 15 or 20 years, but we want to see it happen within month to few years to be able to translate that. And this is where we found the great partner in Michigan State University, being able to bring that research together. We have great researchers on both sides. We have great investment into research that we have put together, and we have clinical teams. So how can we connect our research teams to our clinical teams so that we are making that transformation and closing those gaps? Hence, we needed a place where we bring the researchers closer to our clinical teams. We want them to be on-site, close to our clinicians, so that they are having those dialogues and discussions and knowing how we can make transformational steps in the care of our patients.
And I think what's really exciting about this new research center is the fact that we're going to lean in together to recruit top-notch scientists from all around the world, and particularly those highly committed to purpose, mission. As Dr. Munkara said, those that are incredibly passionate about seeing their research and science get applied quickly and changing practice and changing care and the health and well-being of the citizens of Michigan and beyond. And so I think the ecosystem that we're creating is going to be quite a differentiator, and I look forward to looking back in a decade and seeing the amazing shift in the area that we've made.
I think the partnership has gone extremely well, and I'm so excited about the great work that everyone has done. If you look at every single front we've made some major advances and hit some major milestones. Whether you look at it from an educational perspective, there have been significant synergies that have been driven on medical education, on nursing education, College of Osteopathic Medicine, College of Human Medicine, College of Nursing, across all the geographies that we have been serving. And this is amazing. And this is, again, kudos to everybody who has been involved, because it literally takes a village to drive what you want to drive.
We should never forget that research buildings are ultimately about the people that are inside them, as Terry said so well. But it's also one of the largest research buildings MSU will have ever built, to give people a sense of scale. If you were to pick it up and drop it into the Spartan Stadium, it would cover the field end to end and side to side, 7 stories tall. So it's a big, big building on campus. If you put ISTB and the IQ lab buildings together, about the same size as those 2 buildings combined, to give people a sense of scale. Not about the scale of the building, but about creating a critical mass. And it won't be the only place this happens, importantly. This is around beginning to build an intellectual community between MSU and Henry Ford. One of our opportunities and challenges is not just about the health colleges. It's bringing in the other colleges throughout campus. ComArt Sci has a speech pathology program. CANR has nutrition programs. So there are lots of connections to health across the university, where those colleges have never had the opportunity to have access to a research and academically oriented clinical platform. Henry Ford is a $7 billion going on $10 billion health system in the state, and that is a platform for research and education for our faculty and students is something we're excited to begin to broaden across the campus.
This is so good for both sides, and then the state of Michigan, right? I mean, this is
Absolutely, and most importantly to our communities. I mean, one, our goal and focus, again, is to improve the health of our community. So, 2 is that to educate and uplift the research and medical education, as well as Norm has said, education across disciplines by coming together. So imagine bringing more of the Michigan State capabilities to our campus and bringing more of the Henry Ford Health capabilities to the Michigan State University campus. The third is the investment that we are making. If you look at it, what we are planning to invest collectively at the present time between research and a clinical enterprise, as well as rejuvenation of Midtown, is close to $3 billion. And this has a significant economic uplift for this city and for Detroit, and for most importantly for the communities we are serving. Financial health is part of regular health, of physical health. People need to be able to afford good food, be able to afford good housing, be able to afford access to care in that regard. So we really believe that this is of significant impact, and this is why we believe this can be a model really for how state university healthcare systems, as well as other partnerships such as the Pistons or others, can really enhance and improve communities.
I think just the excitement that we're all experiencing, I think it's a really rich environment. The growth and educational opportunities that we have for our students in Detroit, with the desire to go full circle and keep them as employees in Detroit and across the state. I also am really excited about the intellectual communities that we're starting to foster with a little bit of investment in seed funds. We're bringing scientists at Henry Ford and Michigan State University together in ways to go after really large funding mechanisms from the National Institutes of Health, and we're successful in achieving those. And that really just allows us to tackle these problems from all sorts of dimensions so that we can really make a difference.
Henry Ford Health is part of the National Institutes of Health's Cancer Screening Research Network.
We are one of 8 sites, and what this enables us to do is actually participate in clinical trials, a clinical trial network where we will be testing out merging technologies so that we can detect cancer early. And so it's really impressive that we're only one of 8 sites across the whole country. And I think that's a wonderful opportunity for our citizens of Michigan to be right at the forefront of these novel discoveries, and most importantly, actually contributing to those discoveries, because so often our research has been on white males dominantly, right? And if we're going to make a difference in our communities and impact the health of the world, we need those clinical trial participants to look like the state and the nation and the world, so that we really can find effective treatments that will be applied to everyone and make a difference in their lives.
One of the main areas of focus of our partnership is cancer care. And the reason we decided to kind of make that a major focus area is the fact that cancer mortality continues to be rising. It's one of the top causes of death among adults in the United States at the present time. And this is driven by a number of things. One, the fact that many times we diagnose cancer in an advanced stage, that some of the treatments that we have are ineffective or inefficient, side effects are high, access to care are not that great. Health disparities and outcome disparities in cancer are very racially and ethnically dependent in that regard, and the data is very clear on that. And this is why we determined that this is going to be a significant focus for us. And at Henry Ford Health, we have been leaders in the field of clinical cancer care for not only years, I would say for decades. This is why we've been investing in our people. I would say that we have some of the best clinicians in cancer around the nation and around the world. I've worked with many around the nation, and I can tell you we have the expertise into every single kind of cancer that you can think of, except for pediatric cancer, because we don't have a children's program or a children's hospital in that regard. But we also wanted to connect it with our research programs. So this is why we have invested, one, in a clinical building that cost us upwards of $170 million a few years ago, that we opened literally the same month, in fact, that we signed our partnership. And now we are breaking ground on another $335 million building for research, and significant part of it is going to be focused on cancer research. We've been having a lot of philanthropy, over $30 million of philanthropy, that is fueling our research in pancreatic cancer, in lung cancer, in brain cancer, as well as many other tumors. We have invested internally in recruiting researchers. So over the next few years, we are going to recruit 4 to 5 researchers every year over the next 7 years. This is in addition to the hundreds of researchers that we already have, and many of them are involved in cancer research. So this is an area that is a significant area of focus for this partnership. We are making significant advances in that, and we are very excited where this will take us.
I think the takeaway would be that we're just beginning. The research building will be a physical manifestation, really the first physical manifestation of the partnership. But as Dr. Mankara said, we've been at this for 3 years, and a lot of work has gone on to begin to build that community. Terry's had the unique opportunity to work in the role between the organizations and sort of helping bring that culture alive. And I'm excited to see us begin to broaden our footprint, and again, bringing in parts of the university to the partnership, so they're realizing the potential of it, and really begin to have an impact on the ground in the community, not just here in Detroit, but across the state. And those are the kind of things which is why we get up in the morning to do this, and why we form the partnership to begin with. So having it become manifest, I guess, would be the thing I think we can begin to look forward to.
To echo what you said and to build on that we are going to make a difference. And I just invite all your listeners to join us in making that difference. And the future is very bright.
We are very excited about the partnership, what it has brought, and honestly looking forward to President Guskowitz as he takes the helm of Michigan State University. I happened to read this morning the interview that he had at Crane, and the focus that he is going to have on increasing research, collaborating with other state universities in Michigan. And to me, we are always, in research, there is always collaboration. It is, I do not look at it as a competition. It's how can we bring our best minds together to make the best discoveries, to innovate, to make a difference in healthcare. This is how we are going to improve. And this is why we are really looking at working and partnering with the new leadership at Michigan State University, and continuing that journey that we started a few years ago, and looking that 30 years from now, not me definitely, but people who are going to be in here, be looking and kind of saying, oh my God, this was an amazing, amazing vision, and how we realize it and how we made a difference in the health of our communities.
It's the Henry Ford Health plus Michigan State University Health Sciences partnership that we've been talking about. Much more online at henryfordmsu.org. And I'm Russ White. This is MSU Today.